Hi, everyone. Welcome to Provider Spotlight. We are so excited to be continuing the show, and we get to interview really amazing providers and hear their unique stories. So today we have Joel Gyimesi, a movement medicine, chiropractor performance, and recovery. He's based in Philadelphia, PA. He's a graduate of Logan University, where he became a doctor in chiropractic. He is a certified chiropractic sports physician and has a master in sports science and rehabilitation, as well as being certified as an active release provider. His philosophy is, if you have a body, you are an athlete. Joel provides movement solutions to patients to help them perform better in life, especially when they're dealing with a new or reoccurring injury. So welcome, Joel. Yay, we're happy to have you.
Thank you for having me. It's a great honor.
Yes, we are super excited to dive in here, so we will. So tell everyone, how did you get into your specialty?
Yeah, I would say my story is, I'd say it's pretty boring, kind of generic in a sense. Like if you ask anybody who gets into maybe a healthcare profession, it's like they had a good experience with someone in the profession and kind of got the gears turning. And as they kind of went through school, it was kind of like always in the back of the mind. And I'd say my story has those underlying themes. I played soccer for many years growing up, had a whole host of different injuries through that sport. And then when I got to high school, I transitioned into long distance running and had a pretty gnarly injury there. And at the time, my parents were seeing a chiropractor for my dad's back. And, one thing kind of led to another as far as like thoughts of like, hey, maybe he can help you with your hip issue. And sure enough that I went and within, a couple of sessions, I was good to go essentially. And whereas, prior to that, I went and saw a bunch of other healthcare professionals, and it was kind of like this doom and gloom scenario. And he was actually, create an opportunity for me to see it differently about my situation and really help empower me with, getting through the process and getting back on the track and so on and so forth. So, throughout my time as being an athlete in those different sports, I went and saw him and it was great. Went through college. I knew I wanted to help people. I just didn't know in what capacity. And then when I graduated, I was my biology, and my mom was like, well, what about chiropractic? So I went and shadowed him again. And one thing led to another. I went to Logan. They have a really good sports med program. And so that's essentially all she wrote.
Yeah, well, that's not a boring story. From your own adversity and injury, someone had given you hope, and now you give other people hope. So you're just returning the favor to people that you now serve, which is pretty incredible.
Yes.
Yes. So what often prompts people to come and reach out to you? What are like the most common injuries, or what do you see a lot?
Yeah, I would say, I say, but most of my clients are general population. When I say that, like, hey, I'm a sports chiropractor, like, oh, you just treat professional athletes, or just, amateur athletes. I mean, yes, I mean, there are those potential opportunities, but most of the people that I see are just everyday people. I'm a big believer life is a sport, and the better you are at playing at, the better you're going to be for owning it.
Right.
And and what that looks like to you is going to be different to me. But if you're dealing with recurring issues, whether it's hip issues, back issues, shoulder, neck, you name it, and you have to now change how you play the game, well, that becomes an issue potentially, and who wants to do that? So that kind of segues into the lead-in line. If you have a body, you're an athlete, by Bill Bowerman, co-founder of Nike, and that's how I view people. That's how I approach people essentially, and that's how I try to empower people. It's like, you are an athlete. It's just that your life now is your sport versus you playing a sport, if you did play a sport when you were younger.
That's so
but
great.
To pivot off of that, so how people find me essentially is more often than not, they've already seen other providers. They've been told a lot of different things about their situation, or they've already been treated on some level for their situation and were dissatisfied with the outcomes. And they're now looking for another option or a way to get to where they want to go. So that's typically how people find me or get in contact with me at that point. I do have some clients that do approach me with an acute issue, something that just happened, maybe a couple of days ago, or maybe, essentially a couple of days ago. But for the most part, it's people that have been dealing with ongoing issues.
Yeah.
Yeah.
No, it's amazing. It seems like you're just so investigative and you're really just down to meet people with where they're at in life and wherever their injury is, and do whatever you can to get them to progress further and to get better. And just really, they know that they've hit a wall, and that's why they're coming to you, is because they're out of options. And these people have told them a lot of things, and you're here to bring a new perspective and also bringing back that hope again, So I think that's really awesome. What do you find is like the hardest part about what you do, and what is also the most rewarding part about what you do?
Yeah. I'd say it's a double-edged sword. So it's both sides of the coin on this one.
Yeah.
So getting back to, someone sees somebody and they're told about X, Y, and Z in regards to their situation. And if I was a betting person, more often than not, it's not a pretty story as far as like what's told about their situation. I'll use like back issues, for example. They go get some imaging. This could be a 20 some odd year old, 30-year-old, 40-year-old, 50-year-old, whatever. They get some imaging. They see some bony changes, whether it's an X-ray or MRI, or they see some changes with their disc, whether it's a disc bulge or herniation, and so on and so forth. It's like doom and gloom, and they now have these thoughts. They have these ideas about their situations. Like, oh, I'm broken now. I'm never going to be able to get back into things I want to do, whether it's, just having zero fears about bending down and picking something off the ground, to say, like, if it's a 50, 60-year-old and they want to pick up their grandkids, or maybe it is a 20, 30-year-old and they just want to get back into playing their sport.
Yeah.
Right. So there is that element. So the behaviors around the situation, the mindset around the situation, but then on the other side of that coin, the reward is seeing the light bulb start to go off in their head. It's like, oh, wow. Right. Although I have these things, and these things might still be there in the future, but I'm starting to see a change now in my abilities to do these things. Right. And so what we see on those studies don't exactly line up to what the potential is from a functional standpoint to get back into these activities.
Yeah. For sure. A lot of people throw out a diagnosis and then tell you no plan on how to move forward from that. And they just let the patient just kind of sit with that information, which is not good. So it's great that you have the information, and it might be tough, but you have the plan and the ability to move people forward, and, giving that hope again, bringing that back is a huge deal, and getting them motivated. And it's not easy. It could be painful doing some of these things, but this is what's going to make them better in the future, and, to move on. So I think that's really incredible. What would, just kind of lining up with that, what are some tips for people to either maintain their health, or to take maybe the first step in maintaining, maybe some things that you've taught them, or, just starting their journey? What would that, like, number one tip be, you think?
Yeah. It has a lot that my response is going to have it's going to have a lot of prongs to it, so to speak. So, I would say, first off, if you're going to be consulting with somebody, whether it's a chiro, a PT, an ortho, whatever specialist, even a general practitioner, you want to find someone that's actually going to sit down and listen to your story. and that's going to kind of give you that's going to give you an opportunity to gauge like if this is going to be a good outlet for me or a provider for me to continue to work with.
Yeah.
Your story is a critical piece in this whole endeavor in getting you to where you want to go.
Mm-hmm.
And that's a pillar in my practice when it comes to working with somebody. Mm-hmm. If all they're doing is looking at the computer screen or just asking you just some very generic questions or interrupting you when you're trying to talk, those are all yellow and red flags in my mind, especially if I'm going to be consulting with somebody for my own health purposes. I really want someone to be invested in me versus, just trying to string me along and then, here's your script and see you later.
Yeah.
Type of thing. So I would say that's a big piece right there. I guess to pivot off of that, when it comes to pain, and this is going to be very subjective to the person, having some framework around your discomfort is also extremely important, especially if you've been in pain for a long time. The technical term would be like chronic, right? But understanding like what's acceptable and what's not acceptable when it comes to your discomfort. So I like to use a traffic light analogy. You got red, yellow, green. Red is like, man, this thing is angry right now. We're fighting. It's in a bad mood. That means like, hey, maybe I need to take an Advil of some kind, or I just need to go do something different, right? It doesn't mean you hurt yourself. It's just, it's mad at you right now, right? Mm-hmm. Yellow, it's like, hey, I got some discomfort. I can deal with it. I don't need to go take Advil. I don't need to go do anything special. I'm aware of it. It's talking to me. I can just keep doing what I'm doing. Green is like an afterthought. If I don't think about it, I don't notice it. So like moving forward, whatever you're doing in life, yellow and green is perfectly acceptable. We believe in some shape or form that it's not normal to live with some sort of it's not normal to have some discomfort in life. But the reality is it actually is normal. Like you're going to encounter it in some shape or form. So yellow and green is perfectly fine. Red, it is what it is. Just go do something different. So, yeah.
Totally. No, I love that philosophy. I think that's really good to keep in mind, especially when you're kind of doing a body scan. You're like, what am I feeling today? So that's a really good analogy for people to think about when they start to think about their care and when they know it's time to do something about it. So I appreciate that. One last question. What do you wish some people either knew about you or your field?
That's a great question. Let's see. I would say, that is a tough question. About me, I guess I'll go with about me. I think it's, and I kind of alluded to it earlier, I think it's extremely important when it comes to your healthcare to cultivate a relationship with that person across the room from you. Mm-hmm. You're a human being. You got thoughts, you got needs, you got concerns, right? And finding someone that's willing to go down that avenue with you to understand those things really, really well is a win-win on all fronts. It's a collaborative process. And that's something that I'm very passionate about when it comes to working with anybody, any client in particular. And it's a big element in my professional relationships and also in my personal relationships.
No, I totally understand that. And I think a lot of people can understand that and gravitate towards it because, especially when someone's in pain, they're like, I need someone who's going to understand what I just went through and understand the pain. And you've been through that with your own experience, being an athlete and, having adversity and injury but also bringing that here to someone and be like, I understand you. I understand what you're going through. I've also been there, but now I have the tools to, do the deep dive with you and help make things better. So I think everyone wants that when they're in pain. They want someone that is going to be like there in the long haul, like, with them and be like, yeah, we're going to figure this out together. Like we're going to do it. So that's very cool.
Yeah, 100%. It's, I find that today with healthcare, there's too many barriers of entry when it comes to like, especially with like really serious stuff too.
Yeah.
Like trying to get a hold of that provider. I got questions, right? And you got to go through their whatever their administration and their, it goes to their inbox. If it goes to their inbox, if you're, trying to reach out via email or leaving a voice message, right? So like, there's like little personal touches. Like when I'm working with a client, I freely give them my cell phone number. It's like, listen, you got a question, you're going to be getting a text from me in a couple of days anyways, just reaching out to see how you're doing. I want to make sure that there's active dialogue when we're not together, so that if you do have questions, you can freely ask me. It's you're not infringing on my personal time, unless you try to text me at midnight. I might not answer. But I have yet to have anyone do that. So yeah.
Valid, very valid. Well, this has been great. Joel, last thing for everyone that's watching, please tell them how they can get in touch with you. And that will be the last question for today.
Yes, I'd say a great entry point would be checking out my website, movementmedicinrx.com. There's a lot of entry points there that you can get in touch with me, whether it's via email or scheduling a free phone consultation to discuss your story. I have online booking through my site as well for that. Or you can email me at info@movementmedicinrx.com, and I'd love to hear your story.
Awesome. Well, Joel, thank you for telling your story today. We greatly appreciate it. We greatly appreciate you coming on Provider Spotlight, and we hope to have you on again. So thank you.
Yes, thank you for having me.
Thank you. See you soon.